Hi, my name is Johnna. I'm going to be your student nurse today. I'm going to close the door for privacy. I'm going to wash my hands. Alright, and can you tell me your name and date of birth?
Amanda Chu, 3797.
Alright, patient appears stated age, no noted signs of illness. And are you in any pain right now? And are you comfortable?
Yep.
Any allergies?
Mm-mm.
Alright. Patient's mood, affect, and attitude are all positive and pleasant. Responses are appropriate for the situation. And where are you at right now?
Detroit Mercy,
And why are you here?
to learn.
And what is the day of the week?
Thursday.
Alright, patient is alert and oriented ×4. Speech is clear. Alright, I'm going to do a head-to-toe assessment on you. I'm going to start with your head. Do you mind if I touch your head? Alright. Patient's scalp is normocephalic. No signs of lesions, masses or bumps, or parasites. Alright. And there are no signs of baldness or bald spots. Hair is equally distributed. Alright, now I'm going to move on to your face. Skin is dry, and temperature is uniform, and color is appropriate for ethnicity. There are some freckles, but they are symmetrical. The borders are regular. Color is uniform throughout. Diameter is less than 6 millimeters and not elevated from the rest of the skin. Then, can you follow my pen light? Alright, and then can you take off your glasses for me? Alright, and just look forward. Alright. Pupils are equal, round, and reactive to light and accommodation. Pupils are about 2 millimeters in size. And then can you pull down the skin for me? Conjunctiva is pink and no signs of drainage or lesions. Alright, and if you can close your eyes for me and tell me where I'm touching you on your face.
Forehead, chin, cheek.
Alright, and then can you smile for me? And puff out your cheeks. And then can you clench for me? Alright. Cranial nerves 5 and 7 are intact, no signs of facial drooping, and there is facial symmetry. Can you open your mouth for me? Alright, stick out your tongue and say ah.
Ah.
Alright. And then can you pull down your bottom lip for me? Right, pull up your top lip. Alright, oral mucosa is pink and moist, no signs of lesions. Gums are also pink and moist with no signs of lesions and no retracting. Tongue is pink and moist. Uvula is midline and raises when patient says ah. Tonsils are graded at a 1+. Teeth are white and straight. No missing teeth and no dental caries. Alright, I am going to feel your carotid arteries one at a time. Alright, carotid arteries are equal bilaterally at 2+. And I'm going to auscultate them and listen for any signs of bruise with my bell. And then if you can hold your breath for me. And exhale. Hold your breath. And exhale. No noted signs of bruise. Alright, and then can you hold out your arms for me? Alright. Temperature is uniform and color of skin is appropriate for ethnicity. Skin is dry. And I'm going to feel brachial pulses. Brachial pulses are graded as a 1+, equal bilaterally. Radial pulses. Radial pulses are equal bilaterally at 2+. And then, can you squeeze my fingers for me? All right, patient's hands are equal in strength. Then going to check capillary refill. Capillary refill is less than 3 seconds and nails show no signs of clubbing. All right, I'm going to listen to the heart. All right, first spot is the aortic at the second intercostal space, right sternal border. Pulmonic area is the second intercostal space, left sternal border. Herbs area is third intercostal space, left sternal border. Tricuspid is the fourth intercostal space, left sternal border. And then the mitral is fifth intercostal space, midclavicular line. And this is where I would listen for 1 minute for the apical pulse rate. Then I'm going to go back up with the bell of my stethoscope, listening for murmurs. All right, there are no signs of murmurs. Heart is strong. So we're going to move on to the lungs. Just breathe normally for me. Take a deep breath for me. Another one. Another one. One more. All right, you can breathe normal. All right, and then can you lift up this arm for me and take a deep breath. All right, and then lift up the other arm and take a deep breath for me. All right, and then if you can turn for me, and I'll just bring it to your back. All right, just breathe normally. All right, take a deep breath. Another one. Another one. And one more. All right. Lungs are clear with no adventitious sounds. Right, you can, oh no you don't. And then, can you bend over for me? I'm going to assess the spine. Spine is straight and aligned with no signs of curvature. You can sit up. And then I'm going to give your back a little tap and tell me if there's any pain or tenderness. This is the costovertebral ankle.
No. No.
All right. And then if you can, actually don't lay back yet. The anterior posterior diameter is the ratio of 2 to 1. All right, now you can lay back. Okay, if you can pull up your shirt for me. All right, so the order is inspection, auscultate, percuss, and then palpate. So inspecting the abdomen, there are no striae, no signs of lesions, masses, or bumps. The contour is flat. So next I'm going to auscultate, starting with the right lower quadrant. Alright, there are vowel sounds in all four quadrants. The vowels are active and vowel sounds are audible. So next I'm going to percuss, so tell me if there's any pain or tenderness. Alright, there are timpani sounds in all four quadrants, so next I'm going to palpate, so tell me if there's any pain or tenderness. Alright, so organs in all four quadrants, starting with the right lower, you have the right ovary, right ureter, and cecum. In the right upper, you have the liver, gallbladder, and right kidney. Left upper, you have the left kidney, the stomach, and the spleen. And then the left lower, you have the left ovary, left ureter, and the sigmoid colon. Alright, you can sit up now. Alright, moving on to the lower extremities. I'm going to feel for temperature. Alright, temperature is uniform throughout both extremities. Color is appropriate for ethnicity. No signs of lesions or masses or bumps. I'm going to feel for the popliteal pulses. Unable to assess the popliteal pulses, so I'm going to move on to the posterior tibialis pulses. Posterior tibialis pulses are equal bilaterally at 1 plus. And dorsalis pedis pulses are equal bilaterally at 1 plus. There is no edema in the legs or ankles. So next I'm going to do the Babinski test. Alright, the toes did not flare, so that'd be a negative test. Then if you can stand up for me and walk from that side of the room over here. Then turn around and walk back. Patient's gait is steady with no limping or stumbling. So next I'm going to have you do the Romberg test, standing with your eyes closed for 20 seconds. And then I'll be right here if you fall. Alright, 20 seconds is up. You can open your eyes. Patient had no excessive swaying. Had some swaying, but none excessive.